Millions of men over the age of 60, men living ordinary lives, following routines they have trusted for decades, never once thinking twice about what happens when they walk into the bathroom each morning, are quietly doing damage to one of the most important organs in their body. And most of them have no idea it is happening. This is not a rare condition affecting a small percentage of the population. This is a widespread, quietly progressing health crisis that is unfolding in homes across this country at a scale that most people have never been told about. The damage does not arrive with loud warning signs. It does not send urgent signals. It builds slowly, invisibly, in the background of daily life, until one day, the symptoms become impossible to ignore. And by that point, the damage has often been accumulating for years. If you are over 60 or love someone who is, what follows in this video may be the most important health information you hear this year. I am Dr. Albert Winslow, and I am going to show you what is happening, why it matters, and exactly what you can do. And you are far from the only one dealing with this. When researchers and public health professionals began looking at prostate health outcomes across large populations of men over 60, what they found was not a random scattering of individual cases. What they found was a pattern. A deeply consistent, population-wide pattern that pointed back again and again to a handful of ordinary daily behaviors. Behaviors so common, so unremarkable, so woven into the fabric of everyday life that no one ever questioned them. The prostate is a small, walnut-sized gland that sits just below the bladder and surrounds the upper portion of the urethra, the tube that carries urine out of the body. In younger men, it tends to stay quiet and cause few problems. But as men age, particularly after 50 and increasingly after 60, the prostate becomes more vulnerable, more reactive to the pressures placed on it by lifestyle, hydration habits, muscle tension patterns, and daily behavioral routines. According to the National Institutes of Health, benign prostatic hyperplasia, the medical term for an enlarged prostate, affects approximately 50% of men between the ages of 51 and 60, and that number climbs to over 70% in men in their 60s and 70s. Those are not small numbers. That is the majority of men in an entire generation walking around with a prostate that is under stress, a stress that, in many cases, is being quietly amplified by things they do every single day without thinking. Think about the routines that felt completely normal growing up, the habits your father had, the morning bathroom schedule that became a fixed part of life, the way drinking water was handled, or not handled, throughout the day. For an entire generation of men, certain patterns became deeply automatic. And it is precisely because they are so automatic, so invisible, so unremarkable, that they have been able to cause harm for so long without being identified. The connection between specific daily bathroom behaviors and prostate health is one that medical professionals are only now beginning to communicate at a community level. And that gap in communication is costing men their quality of life. What this means for people at this stage of life, specifically, changes everything we need to discuss next. The pattern, when you begin to see it clearly, is striking. Not because it is complicated, but because it is so consistent across so many different men in so many different communities that it stops feeling like coincidence and starts feeling like a system-wide problem that has simply gone unnamed for too long. The first bathroom habit that researchers have consistently linked to prostate strain is something called urinary postponement, the practice of deliberately holding urine for extended periods of time rather than responding to the body's natural signals. For many men in this generation, this habit developed out of necessity. Long work shifts, busy schedules, social situations where leaving to use the bathroom felt inconvenient or even embarrassing. Over time, postponement became automatic. The body would signal, and the signal would be overridden. But here is what most people were never told. The bladder and the prostate are neighbors in a very tight space. When the bladder is chronically overfilled, it creates persistent pressure against the prostate. Over years and decades, that pressure contributes to inflammation, to tissue stress, and to the kind of glandular enlargement that makes urination progressively more difficult. The second habit, one that feels even more counterintuitive, is aggressive or forceful urination. Many men, particularly as the prostate begins to enlarge slightly and the urinary stream weakens, respond by pushing harder, straining the abdominal and pelvic muscles to force urine out more quickly. It feels like a solution. it is actually making the underlying problem significantly worse. The straining increases intra-abdominal pressure, puts additional mechanical stress on the bladder neck and the prostate, and over time contributes to a worsening of the very symptoms it was meant to address. The third habit, and perhaps the most surprising, involves nighttime hydration and what happens in the hours before bed. Many men in this age group, having noticed that they wake frequently during the night to urinate, make a logical sounding adjustment. They stop drinking water in the afternoon and evening to reduce nighttime trips to the bathroom. But concentrated, low-volume urine, the result of reduced hydration, is actually more irritating to the prostate and bladder lining, not less. The body produces inflammatory markers in response to dehydration, and chronic low-grade dehydration has been linked in population-level studies to increased prostate inflammation and worsening of lower urinary tract symptoms. Across the men most at risk for prostate complications, these three patterns appear with remarkable regularity, which is exactly why this conversation matters beyond any single individual. And the pattern does not stop there. There is a second layer to this that affects this age group even more directly. When health professionals began tracking prostate health outcomes specifically within the over 60 male population, a clear picture emerged about why this particular age group carries a disproportionate share of the risk, and why the habits discussed here do more damage in this stage of life than they would have done in earlier decades. The prostate does not age gracefully on its own. As testosterone levels shift with age, a process that begins gradually in the late 40s and accelerates through the 60s, the prostate gland responds to changing hormonal signals by growing. This growth, in many men, is slow enough to go unnoticed for years, but it is happening against a backdrop of other age-related changes that compound the problem significantly. The bladder muscles, which are responsible for the coordinated contraction that produces normal urination, become less efficient with age. The nerve signals that communicate between the bladder, the prostate, and the brain, signals that regulate the timing and force of urination, become slower and less precise. The pelvic floor muscles, which provide structural support to the entire lower urinary system, begin to lose tone unless actively maintained. What this means in practical terms is that the three habits described in the previous section, urinary postponement, forceful straining, and late-day dehydration, create significantly more stress in a 65-year-old body than they would have in a 35-year-old body. The physiological reserve is reduced. The system has less tolerance for the kind of chronic, low-grade strain that it once absorbed without noticeable consequence. For a generation of men who grew up being told to push through discomfort, to not complain, to stay hydrated with coffee in the morning and not think about water the rest of the day, the adjustment required to protect prostate health in later life runs counter to deeply ingrained habits. Many men who grew up in an era when prostate health was simply never discussed, when the bathroom was a private matter and urinary changes were considered an inevitable part of aging, never developed the awareness that these habits were worth examining at all. Public health data consistently shows that men in this age group are significantly less likely than women of the same age to seek medical attention for lower urinary tract symptoms, and significantly more likely to normalize warning signs that warrant clinical attention. That combination, physiological vulnerability plus behavioral normalization plus reduced health-seeking behavior, creates the conditions for a slow, invisible crisis. And what this means for men at this specific stage of life changes what we need to discuss next. What most people in this age group do not yet know, and what represents perhaps the most critical gap in public health communication around prostate care, is that the symptoms they have been told to expect and accept as a normal part of aging are not, in most cases, inevitable. The narrative that urinary frequency, nighttime waking, weak stream, and urgency are simply what getting older looks like has been one of the most harmful pieces of health misinformation circulating in this generation of men. It is harmful not because the symptoms are rare, they are genuinely common, but because accepting them as inevitable removes the motivation to examine the behaviors that are actively contributing to them. When health organizations reviewed outcomes across tens of thousands of men over 60, a consistent finding emerged. Men who made targeted behavioral changes, specifically addressing the 3 habits outlined in this video, showed measurable improvements in lower urinary tract symptoms without pharmacological intervention in a significant percentage of cases. That is an important finding. It means that for a meaningful portion of men experiencing these symptoms, the first line of response does not have to be medication or medical procedures. It can be behavioral change, informed, specific, consistent behavioral change built around an understanding of what the prostate actually needs. The second thing that most people in this age group have not been told is that pelvic floor health is not a women's health topic. For decades, pelvic floor awareness, exercise, and rehabilitation were discussed almost exclusively in the context of women's health, pregnancy, postpartum recovery, and incontinence. Men were largely left out of that conversation entirely. But the pelvic floor musculature is as essential to male urinary and prostate health as it is to female health. Weak or uncoordinated pelvic floor muscles in men contribute directly to poor bladder control, incomplete bladder emptying, increased straining during urination, and long-term prostate stress. And because an entire generation of men was never told this, the vast majority have never taken a single deliberate action to maintain or improve pelvic floor function. The result is a population of aging men with a critical structural weakness they do not know they have, contributing to a set of symptoms they have been told they cannot avoid. Among the adults studied in this age group who began targeted pelvic floor training alongside hydration and behavioral adjustments, the results were remarkably consistent and meaningfully positive. What the community-level data shows next is where the real opportunity for change becomes clear. I want to ask you something, and I genuinely want to know. How many people in your life, family members, close friends, neighbors, men you see every week at church or at the barber or at the coffee shop, do you think are quietly dealing with prostate-related urinary symptoms right now without understanding that daily habits are a significant part of the cause? Give me a number in the comments, even a rough estimate, because those numbers, added together from everyone watching, tell us something important about how widespread this really is. Now, let us talk about what actually works, because this is where the community-level data becomes genuinely encouraging. The first and most immediately actionable change involves what health professionals call timed voiding, the practice of using the bathroom on a regular schedule rather than either waiting too long or going preemptively out of anxiety. For men over 60, establishing a voiding interval of every 2 to 3 hours during waking hours, responding to the body's signal promptly, but not training the bladder to expect emptying every 45 minutes, significantly reduces the pressure load on both the bladder and the prostate over time. Public health data consistently shows that men who implement timed voiding as a structured habit report reduced urgency, improved stream quality, and fewer nighttime interruptions within 4 to 8 weeks. The second behavioral shift involves what researchers call double voiding, the practice, after completing urination, of pausing briefly and then making a second attempt to empty any remaining urine from the bladder before leaving the bathroom. For many older men, the bladder does not empty completely in a single voiding cycle due to reduced detrusor muscle efficiency. Incomplete emptying leaves residual urine in the bladder that contributes to urgency, frequency, and increased bacterial risk. Double voiding, practiced consistently, reduces residual urine volume and takes pressure off the prostate over time. The third area, hydration management, requires perhaps the most significant recalibration for this age group. The goal is not to drink less water. The goal is to redistribute water intake intelligently across the day. A consistent intake of 6 to 8 cups of water, concentrated primarily in the morning and early afternoon, and tapering naturally in the 2 hours before sleep, reduces nighttime urinary frequency without the dehydration-related inflammation that comes from cutting fluid intake altogether. Many people who grew up in an era when drinking water throughout the day was not a common cultural habit find this adjustment surprisingly impactful, not just for prostate health, but for energy, digestion, and overall well-being. And what the outcomes across communities of men who have made these changes show us is that starting this earlier rather than later produces the most durable results. Starting now, today, not next week, is what separates the men who manage this prostate health challenge well from those who allow it to quietly worsen over years. And the good news, which is worth saying clearly, is that none of what works requires a prescription to begin. The behavioral adjustments that have the strongest evidence base are things you can implement with knowledge alone. The first thing you can do starting today is audit your hydration pattern. Not the total volume, but the timing. Pay attention to when you are drinking fluids. If the majority of your daily fluid intake happens in the evening, because mornings are busy, because coffee substituted for water for decades, because it simply became habit, begin shifting that pattern deliberately. Move your largest fluid intake windows to the morning and midday hours. Give your body time to process fluids before sleep. This single adjustment, done consistently, produces measurable changes in nighttime urinary frequency for a significant percentage of men in this age group. The second thing you can do today is begin practicing a relaxed urination posture. This is something that sounds almost too simple to matter, and yet the research supporting it is surprisingly robust. When men adopt a slightly forward-leaning seated or crouching posture during urination, rather than standing fully upright, the pelvic floor relaxes more completely, the bladder angle improves, and the flow of urine requires significantly less muscular effort. Studies have shown that this posture reduces residual urine volume and reduces the straining that contributes to prostate stress. The third action, beginning pelvic floor awareness, is something you can start within the next few minutes. Identifying the pelvic floor muscles is the first step. The muscles you use to stop urination midstream are the pelvic floor muscles. The exercise involves contracting those muscles for 3 to 5 seconds, releasing fully for an equal count, and repeating for 10 to 15 cycles, 2 to 3 times per day. Among men who practice this consistently, improvements in urinary control, stream strength, and nighttime voiding frequency were documented across multiple population studies. For a generation that was never told these muscles existed and needed maintenance, beginning now is not too late. It is exactly the right time. And what each of these changes builds, individually and together, leads directly to what we need to close with today. Together, through this video, you have just built an understanding that most men in your community do not yet have. You now know that the 3 most common bathroom habits quietly damaging the prostate, urinary postponement, forceful straining, and late-day dehydration, are not inevitable parts of aging. They are learned behaviors that can be examined, adjusted, and replaced with habits that actively support prostate health rather than undermine it. You now know that the symptoms your generation was told to accept as normal, the frequency, the urgency, the nighttime waking, the weakening stream, are not simply the price of getting older. They are signals. And signals can be responded to, especially when you understand what they are pointing toward. You now know that timed voiding, double voiding, pelvic floor engagement, and intelligent hydration management are not medical procedures or pharmaceutical interventions. They are practical, accessible, evidence-supported behavioral changes that have produced real, documented improvements across large populations of men in exactly your situation. You are now equipped with something real, and real knowledge shared with real people creates real change, not just for you, but for the men around you who are walking through the same quiet experience without the language to name it or the information to address it. I want this community of people, everyone who watches this channel, to genuinely thrive, not just individually, together. Because prostate health is not a private embarrassment to be managed alone in silence. It is a shared health challenge that deserves honest, open, community-level conversation. Share this video today with a family member, a friend, a neighbor, a man in your life who you suspect has been quietly dealing with this and never said a word. You do not have to frame it as a medical alert. You can simply say, "I learned something today that I think you should hear." And stay with us, because every video we make is built with exactly you in mind. Your health, your generation, your community, and your right to live the second half of life with your body working with you, not against you.